I invite our first presenter, Hamna Shaikh from LUMHS. She'll present her research work on a cross-sectional evaluation of histology teaching in clinical years of MBBS at Liaquat University of Medical and Health Sciences, Jamshoro.
Assalamu alaikum everyone. I am Hamna Shaikh, a fourth-year MBBS student at LUMHS Jamshoro. Today, I would be leading you all to this journey of our research study, which is a cross-sectional evaluation of histology teaching in clinical years of MBBS at LUMHS Jamshoro, along with my co-author Vijay Prem, under the mentorship of Dr. Fahmida Gul. Well, before we proceed further, I would at first like to highlight the key subject in our study, which is histology. With its brief yet completely different domain from other subjects, we acknowledge that histology is an integral part of preclinical years for obvious reasons. We also acknowledge that it has been induced in our curriculum because of some reasons, and it just does not end here. It is also a part of pathology too. So ultimately, it becomes crucial to study histology in first year and second year of MBBS. With this exact significance, we built our rationale around the concerning complexities which are faced by the students regarding a sense of dislike towards this subject, despite being a minor one. Even with proper assessments and examinations, students fail to develop a conceptual hold of the subject, which affects their academic morale badly. So our main objective was to evaluate clinical significance of histology among undergraduate medical students and to identify areas of improvement in its teaching methodology. We conducted a cross-sectional evaluation among undergraduates of MBBS at LUMHS Jamshoro through a structured questionnaire on Google Form with the ethical approval of Ethical Research Committee of LUMHS. About 220 responses were collected, out of which 73.6% were able to utilize knowledge of histology in their clinical years. 58.2% of the audience had developed good interpretation of histopathology, and with even more astonishing figure, 91.89% still feels valuable changes to be brought for better outcomes, like integrating histology and histopathology and using modified teaching visual tools. Now, this is a graph showing perception of students regarding histology of which module was the most difficult to study and histology of which module helped them in relevant study of other subjects. Now, surprisingly, both the bars reached maximum peak for the module of hematology. We also conducted a Likert scale for the most controversial part of our study, which was feedback regarding making practical journals and drawing diagrams. 30.9% was the highest figure, falling between rating of 4 to 6, which is somewhat a non-compelling and a neutral opinion. So we compared our results with two other studies. One from Shifa Tamir Millat University, which showed improved retention of knowledge of histology with drawing images, and the other one from Redbound University in the Netherlands, where drawing group of students won the race of better retained knowledge of histology than the non-drawing groups. Well, practically speaking, the results could vary depending on individuals' preferred way of learning the things. So there is no such evidence which could prove that our students do not prefer making drawings and images because of any obvious reason, but just because of their own lack of personal interest. Let's move towards discussing some relevant studies. 41.8% of the audience had difficulty in observing the slides under light microscope, which is definitely a huge figure. Now, a similar study at University of Alicante reported even more than that number of students with same difficulty of studying the slides under light microscope. Guess what? The primary reason which participants in both the studies stated turned out to be common, which was poor development of knowledge of basic anatomy and histology in preclinical years. In another question, 26.4% of the audience were not able to utilize knowledge of histology in their clinical years at all. Now, strikingly, same results were obtained at a similar study at Volo University, Ethiopia, where more than 1/3 of their audience were not able to pull off knowledge of histology in their clinical years. Now, why do students have to face this failed approach? This is the actual question to address. Apparently, students reported insufficient basic knowledge of histology and anatomy in preclinical years, failure to interpret microscopic images, lack of active communication with demonstrators, inability to recall the topic without a prior revision, and less duration of lab sessions, which are all suggestive of poor development of basic concepts. At the same time, students also suggested conceptual focus on the topic rather than a reading approach, eliminating journal writing, use of visual microscopy, which is an innovative tool with proven positive results, using real-life histopathological images to study under microscope, and using atlas for comparison of normal and abnormal features. Well, to conclude the journey, we have finally come to the end of our presentation with an insight that poor knowledge of histology is a damaging factor for the learning of other relevant subjects too. So the feedback of the students should be acknowledged, and certain described modifications should be brought in the teaching methodology. For future, more conceptual and visual learning with proper assessment should be adopted by the institute. At last, I would like to highlight the study limitation that might have occurred due to a lack of multi-institutional approach for the study purpose. Well, this brings me officially to the end of my presentation. Thank you so much, everyone. The podium is now open for questions and answers.